The member for Bowman.
Mr Speaker, we all welcome a bipartisan approach to reducing Indigenous smoking, and the great killer of both mainstream and Indigenous Australia is smoking. It's directly correlated with a range of cardiovascular disease, stroke, peripheral vascular disease and a range of cancers. We know that it's not only direct impact of smoking but also passive smoking that is a killer, and that's why both sides of this House are so dedicated towards reducing those rates. Now, with Australians in the mainstream, we can be very proud of outcomes. We've seen falls in smoking down to the mid-teens, which, apart from a few states in the United States, is the lowest in the world. And a pat on the back for that and consequential governments that have worked hard to achieve those great figures. We know from pregnant mums those smoking rates have fallen from mid-17s to mid-14%, and that is incredibly important when we're looking at perinatal morbidity and babies coming into this world as healthily as they can. But with Indigenous smoking, the story isn't so good. While there's been interest and support from all levels of government, what we now have is the ultimate in bureaucralese with the new implementation report, the new partnership agreement struck up by the federal government with each of the state jurisdictions, in which measures in closing the gap around smoking do not for even a moment, not even a passing moment, reflect the number of cigarettes being smoked by Indigenous Australians. Now, that takes quite a lot of conception to come up with implementation goals towards closing the gap that actually doesn't look at cigarette smoking at all in efforts to reduce it. So instead, the bureaucrats have come up with some other options, some other ways of measuring smoking initiatives without actually looking at reduction in smoking. What we know, if we look at these implementation agreements in closing the gap between the jurisdictions and the Commonwealth, is that Queensland, for instance, will focus on S2 and S4. The Commonwealth will focus on S1 and S4, so they're not even focusing on the same objectives, and S3 has disappeared completely and no one's looking at that one at all. Now, this may sound very Fawlty Towers-esque, but let me put this into some context. What are these S1 to 4s? Well, S1 is the number of culturally secure community education and health promotion and social marketing activities to promote quitting and smoke-free environments that are implemented. So let's measure the programs. That's S1. You can almost imagine those who drafted these recommendations saying, for goodness sake, if you're coming up with recommendations on how to reduce Indigenous smoking, whatever you do, don't come up with a recommendation that in some time in the far distant future will be looked back at and seen to have as failed. So instead they've come up with S2, key results of specific evidence-based ATSI brief interventions and other smoking cessation and support initiatives that are simply offered to individuals but not actually looking at if they work. S3, that appears to have vanished entirely from all jurisdictions' attention, is regulatory efforts to encourage reduction and cessation in smoking in ATSI people and their communities. And S4, the number of service delivery trained staff actually delivering the intervention. So as long as we've got more people delivering interventions, we're succeeding. But the reality is, of course, Mr Speaker, that's not closing the gap. We know that about 38% of it, the entire gap, is due to cardiovascular disease, and the number one killer, the number one cause behind that is smoking. And what every Australian would want is a far better focus on reducing the smoking of cigarettes in an effort to close the gap around smoking. But it's not happening, no. With this government, Deputy Speaker, or Mr Speaker, it's more about the army who measures how many bullets they shoot as a measure of success, or the farmer who measures how many seeds they plant as a measure of their profit. But for a moment, let's actually look at what we're trying to do here. Have Indigenous Australians give it up, quit smoking, go to bed tonight as a smoker and wake up in the morning having stopped it. Now, it's fine to deliver the interventions. It's fine to be employing all of the public health professionals. But ultimately, a government is expected by its people to be delivering the services that work. And we see millions of dollars allocated to this initiative. Mr Speaker, we can do better than this. We can do better than 4 truly vague checklist representations of how we're progressing that measures nothing but inputs. How many people are employed? How many public health programs are delivered? It's time we focused on the outcomes, but it's become just lost in this almost bureaucratic overlay of creating outcomes that can never be proven to have been failed because, you know what, it never had anything to do with what we're trying to do in the first place, reducing smoking. This is a great tragedy, and we see the fantastic work by AIHW in an effort to measure falls in Indigenous smoking, and they showed a very, very barely statistically significant 3% drop between 2000 and 2008. But what we know is that ultimately the only way to be sure is to work with Indigenous Australians, allow them to run these programs themselves and actually count the cigarettes that are no longer being smoked.